Aikwi, Nakna, Virginia Hedrick, Shregon Mewamechok. Good morning. My name's Virginia Hedrick. I am a member of the Yurok Tribe, um, raised on the Yurok Reservation in Northern California in Humboldt County. I am a wife and a mother to 5 kids, and also the executive director of the California Consortium for Urban Indian Health. Thanks for joining today. Last week, I did a live on COVID-19 and then have since just continued to get questions as we begin to better understand its movement and its potential impacts. Um, just wanted to keep everyone up to date. First, I just want to note that a lot of things have happened in the last week, even the very day that I went live last week. Within the hour after that, the governor of the state of California issued new warnings for California and issued that very day, last Sunday, issued that Californians 65 and older stay home and that many schools would be closing. And since then, many more counties have issued a shelter in place. There's a lot of questions about what shelter in place is and what it means for community movement. So six Bay Area counties issued a shelter in place. Sacramento issued a shelter in place. Many cities have issued a shelter in place. And then most recently, the Governor Newsom issued a shelter in place for all Californians. And so a shelter in place really means that we're in a state of emergency, that it may not be safe to be out in the greater public, and that we should all be staying home as much as possible. And I know that not everyone has the privilege to stay home, that there are those who are essential workers who are still going to work every day. And the first that come to mind are our healthcare workers, and they are on the front lines. And in Indian country, there are more than 40 Indian health programs here in California, and doctors and nurses and MAs and front desk staff and janitors are showing up. And, I mentioned janitors at the end, but across the nation, um, janitors are doing the work and they're being exposed. And it's important that we stop and say thank you, because they're working really hard to make us all safe. And they're the reason that folks can issue those, notices about how much more they're cleaning and how much more sanitary things are. And, as Indian people, we all know that everyone has a role in the community. And to be grateful for that and to thank people for what they're doing during this time, and to thank those who are staying home, those who are maybe sacrificing hours at work because they are in a position where they're at risk, or they're caring for a loved one that's at risk. I think that's where I got a number of questions. Was I'm caring for a parent, I'm caring for a grandparent, and that's really a testament to Indian country, that we care for our elders, that we're there for them, that many of them, that we're living in multi-generational homes, that many people are raising their children and their grandchildren, or their nieces and their nephews, and they're raising a parent. And, I just want to thank and appreciate all those people who are doing that work too, and doing their best to keep us all safe. So back to the shelter in place and the state of emergency. I think it's a little easier to understand emergencies when they have been natural disasters. So if there were a raging fire outside, and this is a new reality for California, we have been battling large wildland and quasi-suburban wildfires here in the state that have been devastating. And during that time, shelter in place orders or evacuate orders are issued, and they're issued to help direct the public about what they should do in an emergency situation. So we're in an emergency situation. There is the coronavirus, the new coronavirus. Novel means new. The novel coronavirus 2019, COVID-19, is a virus that it's a new evolution of a virus. I mentioned in a most recent post that sharing conspiracy theories or even downplaying the emergent situation that we're in is not helpful. Um, the coronavirus, the name coronavirus, um, the strand coronavirus isn't new. I shared a video recently of a very good friend of mine, Dr. Adachi Serrano, and she was really clear that the coronavirus is commonly known as the common cold. That is a coronavirus. But what we're talking about, COVID-19, is not a common cold. It's not behaving like a common cold. It's far more contagious than a common cold, and it's far more fatal than a common cold. So that's why um, people are very worried. And I saw people say things like, there's not even any positive cases in my county. This is getting blown out of proportion. There's a larger agenda. Because it's new, test kits were being developed by the hour, and there are people who have COVID-19 who will not get a test, who maybe have even already recovered from COVID-19, and we might not necessarily ever for certain know that they had it, but we should assume that the problem is larger than the test kits or any of the data is really showing, because it is true that the vast majority, 98 to 99% of people will recover. And of those people, many will not require hospitalization. That said, that 2% that are dying is a really high percent. And I really appreciated someone who really put it in context for their tribal community. Um, they said, if we come from a tribal community of 600 people and 2% were to die, what does that look like? And what 2% are they? Because the data tells us that they would most likely be our elders. They would most likely be those family members with diabetes or heart disease or a lung disease. And when you hear put it that way, 2% is a lot, and it's really scary. Um, the other piece of information that keeps getting shared is, we survived smallpox, so we can survive anything, or, we got this. We survived smallpox. We are a testament to a prayer. We are a testament to an Indian elder who held out or who went along so that we could be here, that prayed that a future generation would come. That's who we are, you and I. There are many Indian people who did not survive smallpox, who did not survive other infectious diseases brought to our continent. They're not here. And estimates say that anywhere from 30 to 90% of the population of indigenous people in North America died due to infectious disease. That's a lot of people. So it's really, I find to be really disrespectful to say something like, we survived smallpox, we can survive this. That doesn't make sense to me. To me, it feels really like arrogant. Like, yeah, we are the fortunate ones. We're the generation of people whose grandparents and great grandparents and great great grandparents prayed for. They prayed that we would be here, and they certainly didn't pray for us to be here in 2020 acting foolish and acting like we're invincible, because our people, we are resilient. We're a resilient people. We have survived mass genocide. We have survived infectious disease. We continue to survive traumas inflicted on our land right now. And for many Indian people, what's happening to the environment is happening to us. We see it as the same. So, these pipelines, desecration of sacred sites, other atrocities as Indian people that we face, they're devastating, and we show up for them. We show up and we fight and we protest and we work for policy change, and we work to get Indian politicians in places that will do that advocacy for us. And so now is not the time, in my opinion. Now is not the time to say that we're stronger and better and we can get through anything. We we will get through this. Um, I want to note that it does feel really scary, and I would be lying if I said there aren't times that I'm not a little bit scared about what's happening. One of the things that scares me is people going out and buying mass supplies. And I see a comment here from Sonia Tetnowski. She's the CEO of the Indian Health Center of Santa Clara Valley. And, she's recommending that people stop buying mass supplies and make sure that they're available to elders. And there are so many pictures circulating on social media where we have our elders who are in grocery stores and there's nothing left for them to buy. Um, and it's really sad. And for me, it makes me tear up a little bit that we're behaving this way. The truth is, there's enough food for everyone. America produces enough food to feed the country. There's not going to be a shortage of food. There will be a shortage if people hoard and if we behave selfishly. Um, we know better as Indian people than to behave this way. And I'm not blaming this problem on us by any means. I think it's really society as a whole that are doing this, and we need to be better. We need to be better. We really need to be looking out for each other, looking out for our elders, and not just our elders. So a number of people have messaged me and said that they have a child with a compromised immune system, with respiratory issues. And this is really serious, and they're really scared as parents, and this is really stressful for them. Um, and so, I just want to note that during this time, we should be reaching out to behavioral health professionals. And I want to thank Sonia for bringing that up too, that when we're under stress, and particularly as Indian people, um, this kind of warfare against our people, it's in our DNA. And we know that historical trauma is passed genetically, and we may be responding to things that we'll never really understand. And so it's important to call your Indian Health Center, to reach out to a behavioral health provider, just to have somebody to talk to. I know many places are offering video conferencing, and I know this can be awkward, the video space, um, but it does work, and it's helpful to reach out and to let somebody know how you're feeling. I know people are feeling really scared that they're going to get locked in into their homes or not be able to leave, or that there may be looting. And, um, you know, I don't know if that's going to happen or not, but what I do know is allowing that stress to build up in you and suffocate you isn't healthy either. And so it's really important that we take the deep breaths and that we do the things we know we can do, that we take care of our family, that we take care of our homes, and that we try to see the bright side of any of this, right? There are pictures circulating the internet of it really looks like Mother Earth is taking a big deep breath, and the skies are clear in many places of the globe that it never has been, and the waters are clearer in places like Italy than they never have been. Um, and so that gives me like some hope that by us staying home, it's not just benefiting my neighbors or my community, but it's also benefiting the world. We're not driving. um, I went to um, the post office yesterday, and it was the first time I drove my van in like a week, and I thought, that's incredible. I wonder how many of us are not in our cars, are not contributing to that pollution. I wanted to share a little bit about the numbers. Nationally, there are over 15,000 confirmed cases of COVID-19, with 201 confirmed deaths. In California, we have over 1,200 confirmed cases and 23 deaths. These case numbers, confirmed case numbers, continue to rise, and the death number also continues to rise as more test kits become available and as we better understand what's happening. Um, these this is spreading really fast, and we are learning so much about it. I got yesterday forwarded to me a couple of times an audio recording. I can't remember the person who shared. It was an individual sharing ways to prevention methods for COVID-19, and some of it was really great. Staying hydrated, drinking warm water, drinking cold water, drinking any water is going to benefit you. It's going to benefit your body, and it's going to keep you hydrated. And I think that people should do that. Particularly if you're sick, that's the first thing your doctor will say if you have the common cold or flu, is to stay hydrated and to drink plenty of liquids. There is a piece on social media that's circulating that if you gargle with salt water or drink salty water, that can kill COVID-19. And while I wish we could say that were true, that would be amazing. I think if that were true, we could probably stop this thing in its tracks. Um, but there's no science to back that. There's no research to back that. And maybe at some point, science will come out and say that gargling with salt water or drinking salt water had an impact on COVID-19. But I don't think we should be giving ourselves false hope that that will kill it. Yes, Britta, wash your hands. Washing your hands is really the most effective way to prevent spread and to prevent yourself from getting it. And when I share this with my kids, I told you I have 5 kids. They are like, don't touch that; it can seep in your hands, and it made me think about how literal they're taking this washing your hands. The fact is, the virus does not soak through your hands and get into your bloodstream. Someone coughs on something or they sneeze on something and the virus is on a surface, and you touch that surface with your hands, and then you touch your mouth or rub your eye or scratch your nose. That virus then has a vehicle to move into your lungs. So it gets into those moist areas in your mouth and your nose and your eyes, and you have just put it in a car and it can drive right to your lungs. And this is a respiratory illness. So that's why we're saying wash your hands, is this right here. This is how it's getting into us and how it's spreading so much. And when we say that there are community transmission and unknown community transmission, there are people who are testing positive for COVID-19 who don't know how. That means they were not in contact with someone who had traveled abroad. They have not been in contact with someone who was on a cruise ship. They, to their knowledge, have not been in contact with someone who they knew were sick. Which is why we've moved from quarantine measures to mitigation measures. So it's really important that you wash your hands for 20 seconds. This isn't just like a rinse your hands off in the water and we're good. You really need to spend the time, 20 seconds, make sure your soap is bubbling. People have asked me, what kind of soap. Really, if you have a soap that suds, that should do it. 20 seconds in between your fingers, on the back sides. I've been watching my kids wash their hands, and it's pretty disappointing because they're like, and done. That's really not effective hand washing. And so, if anything, I hope we all come out of this hand washing experts, that we wash our hands front and back. I realize that people are leaving the home to get groceries, to get essential needs, to set up home offices or get supplies for many people who have their children at home with them. So as soon as I come in the house, I am washing my hands. It's also not a bad idea to even think about changing your clothes. And this isn't I don't want to scare anyone. I'm not trying to increase fear. I think the more we know about how we can protect ourselves and how we can protect our family members, the better off we'll be. We do know that this virus is going to hit Indian country. And throughout the state of California, I think the last I looked, over 40 tribal casinos have closed. Some have given dates that they'll reopen, and some have said we're watching this and monitoring closely, and we'll reopen when it's appropriate. And I really applaud those communities and those business councils and those tribal councils who made that very difficult decision. Um, for many tribal communities, that source of economic revenue is really important. Not only does it employ the people who work there who would otherwise be unemployed in areas where the tribe is the largest employer, um, but it really brings revenue back to education, to cultural resources, and other things that most grants won't fund. So I don't take it lightly that so many tribal businesses have closed, nor do I take it lightly the impacts that will have. We have seen reservations, not just in California, but outside of the country or outside of the state, that are closing their borders and exercising their sovereign right to limit who can come on tribal lands and who can't. And that feels scary. And it feels scary for residents of the tribal on tribal land. And it feels scary for folks driving through. Um, but we shouldn't be scared about these measures. We should see them as an exercise of sovereignty, that tribes have very vulnerable communities that live on tribal lands. I spoke to one tribal representative yesterday who is leading up the emergency response at La Jolla. His name is Adam Geisler, and La Jolla did something that I thought was really incredible. They issued a survey to all of their residents to assess their risk. So they were looking at if COVID-19 were to come on tribal land, what could happen and how vulnerable and how at what risk is our community at. And they found that almost 55% of their residents would be at risk for severe outcomes. That meaning they have an underlying health condition or an age category that puts them at high risk for severe outcomes. 55%. Um, I was expecting that number to be high. I wasn't expecting it to be that high. And that kind of data informed decision making is incredible. And I am sure that they're not the only tribe who are making decisions in this manner, really looking at their tribal community and the populations that they serve to determine what's our risk if COVID-19 were to come on reservation. Um, communicating with members and communicating with people what's happening is so important so that folks feel informed and they know how any potential closures will impact them personally, impact them financially, impact their communities is really important. Um, I know many agencies and organizations have been able to, um, issue additional sick leave or continue to pay their employees, and many cannot. Many don't have that kind of resource, um, and they are, pointing their employees to unemployment. And I encourage people to take advantage of that. Policy advocates and people worked really hard to make sure that during this time of closures, that we would have um, access to unemployment for reasons that are not the fault of the employee. And so we should be accessing that, and you should be assessing your risk, and then if you need to access that. Britta, I agree. What we have seen from the highest leadership of this country in terms of racist behavior, and I didn't want to get political, and I never want to get political, but it's unacceptable. It's unacceptable to use terms like the China virus. This is not the China virus. This is COVID-19. Um, to be treating our fellow community members um, like they have the plague or like they're the infected individuals is absurd. If we were to look at the demographic of individuals who are, and by demographic I mean like race, age, class, income levels of those folks who are getting off cruise ships, and those folks who are coming back from international vacations, um, I think we would have, we'd all be thinking a little differently. And I'm not going to share that. And that's coming from an ugly place too. But it's not okay. It's not okay that we're no longer ordering takeout from a Chinese restaurant because we think we have some justified reason to be scared. There's no justified reason for that. Um, it's racist, it's inappropriate, and it's not right. And I was on a tribal call, a tribal leaders call last week, and a tribal leader from Warm Springs was talking about the stigma of being a dirty Indian. And if any one of you have ever, well, I guess as Indian people, we all experience this. Um, you know, when you're out in the larger community and people know that you're Indian, sometimes there can be a stigma with that. And so we should know how to behave and not to behave, because we as Indian people have been treated really poorly on the basis of our citizenship status in a tribe, on the basis of growing up on reservation, growing up off reservation. um, we well know and understand stigma, and we should not be circulating that same kind of hate that has been that we have been fighting for generations. We need to behave better. We need to stand alongside of our brothers and sisters who are being persecuted unjustly. And I'm seeing in the news signs of physical abuse and attacks on Chinese people, um, and other Asian people who are not even Chinese are suffering from this bigotry. And we need to be better than that. We need to be smarter than that. We need to be more intelligent than that. And we also need to be supporting this community who is seeing this kind of language come from the White House. And we need to let them know that we're here and that we're all in this together, because we really are. And we need to behave like that. We need to behave like we know better, and we need to be coming from a place of understanding, because we do understand that. And when I heard that tribal leader from Warm Springs speak about what it's like, um, that even right now in COVID-19, those surrounding communities or outside the reservation are saying horrible things like, do Indians even have access to soap? And they're the ones that are going to spread this. It's disgusting. It's disgusting. Um, and we cannot tolerate it. And we can also cannot contribute to it by being part of those hurtful and harmful conversations. We just can't. A little bit about Indian country's response. So there was an article in Politico yesterday about stalled funding to Indian country. And first, I can't speak for the country. I can't speak for the Indian healthcare system. Really, outside of the Urban Indian Network here in California, who I have been in contact with on a daily basis about their efforts. And this isn't me like taking a moment to brag, but I will take a moment to share that our urban Indian health programs in the state of California have had an incredible response to this. They have moved swiftly. They have put measures in place to protect both their staff, their patients, and the larger community. They have been tracking this from day one. They have been following all the guidance issued by CDC for healthcare centers, and at a loss to their programs. So when a Indian health center or any health center um, closes or reduces their availability to patients, they lose revenue. And first, I want to note that that patient loses the opportunity to have a face-to-face contact, but we're going to feel the impacts to the Indian healthcare system for even the next coming year. Will we feel what's going to happen over the next month, 2 months, potentially 3 months, maybe even longer, where we feel the losses to Indian country in terms of the reduced ability to see patients at the volume that we were before. So again, I want to appreciate that even with a lack and even with a stalled funding from the federal government, that the urban Indian health programs in California are responding to this appropriately, as I'm sure our tribal health programs. I've seen tribal health programs issuing really similar notices to urban Indian health programs, and they're going to be in the same place. So the issue with funding is there was originally 40 million in the first like COVID-19 funding package that went to the CDC for Indian country, and immediately folks started asking. Our organization issued a letter trying to expedite these funds from CDC to Indian country and how that would work. And by CDC, I mean the Centers for Disease Control and Prevention. Um, HHS, Health and Human Services, issued a notice on Friday to Indian country that CDC has increased that 40 million to 80 million, and that includes money for the National Council of Urban Indian Health, for the National Indian Health Board, for Indian Health Service, geographic area health boards, and the additional and the rest of the money, which I think equates to either 30 or 40 million, would be issued in grants to Title I and Title V Indian organizations and tribes to respond to COVID-19 and recover their costs. There are still a lot of unknowns about how this money gets where it needs to go, how fast it gets there, and what are the funding formulas. So if you're wondering about how this will look locally for you or your Indian health program, I don't have those answers yet, and I don't know. Probably by late next week, we'll know better about how this 80 million will be distributed to Indian country, um, and how fast it'll get there. In the meantime, know that your Indian health centers are they're running on money that they don't have yet, and they're doing an incredible job with, in some cases, many limited resources. Um, when we talk about the healthcare delivery system as a whole outside of Indian country, we know that there is going to be a shortage of masks, both N95 and surgical masks, and that there is going to be, and already is, a shortage of what's known as PPE, personal protective equipment, gowns, shoe covers, and we have patients coming in the facility and they're grabbing like handfuls of those surgical masks. That's not appropriate either. Our health workforce needs those, um, and they are the ones at highest risk that are going to be having more touches with this virus than really anyone else. So it's important that we only take what we need, and that really goes for all of this. Um, the other thing that I wanted to share is, when I say we don't know, it's not like me and this mouse in my pocket. It's when I'm looking at the research, when I'm looking at the science about what we know about COVID-19, and when can we expect the virus to, remember last week I shared that it's going to rise on a curve, and that the attempt is to try to flatten that curve by lessening community transmission, by lessening the number of people who are literally touching the same things and being in the same spaces. That instead of this thing skyrocketing like we saw it on this trajectory of skyrocketing, that we could get it to maybe hit a high peak here and then come down. And as this is coming up, we would have people recovering at the same time. I shared some really incredible graphics from the Washington Post about that. So if you look on my page a few posts back, there's some really great graphics about what happens when you quarantine just those individuals who are sick. What happens when 25% of the people stay home and 25% of the people shelter in place, and what happens when 75% of the people shelter in place. That's when we really see a flattening of the curve. And so if you're feeling frustrated that you're seeing people out and about or on social media that they are not adhering to the shelter in place, it's really important that we all take this very personally and that we do our best to shelter in place. And it's not easy. None of it's easy. I am trying to homeschool, trying to work from home. Um, it's a challenge. It's not, and I think many people are feeling this challenge. I read something recently, though, that resonated with me that said, give us an opportunity to allow your children to get the extra sleep that they needed, to not pass this stress on to them. And in our household, this conversation I'm having with you all virtually, I'm having every single day as I'm learning new things. And I'm considering it as like my public health lessons. Like, oh, my kids are going to come out of this like public health advocates and infectious disease control experts about best practices. Um, I started all of this to say that people are asking, will sunlight, will warmer weather kill COVID-19? And so are we looking at like when we start hitting summer here in California um, in June, will COVID-19 just begin to drop off anyway? So what we know about COVID-19 is its favorite place to live is in moist areas. It's in the lungs, it's in the throat, it's in ears, nose, and throat cavities. Um, so there's thought that if things got hot and started to dry out, that might be the case. But we don't know that. So first, the answer is we don't know. We don't know what the impact that summer and warmer weather will have on COVID-19. Um, maybe it will, and we'll just have a natural drop off. We're seeing cases in areas in the United States with warmer weather, and so I'm going to be really honest. I'm not super confident and that will happen, but it's possible. It's possible just based on like the basic things that we know about COVID-19. Um, so I'm coming up on 40 minutes and I've said a lot. What I want to share with people is that um, Indian people were resilient, we're strong. We know how to respond to emergencies. We know how to behave in times of crisis. And it's that now is the time. Now is the time that you dig deep for yourself, for your family, for your community, that you find that calm strength inside, that we stay calm, that we do all of the things that we know to be preventative of COVID-19, that we are washing our hands, that we are sheltering in place, that we are staying home as much as possible, that if we are an essential worker and we are working in a grocery store, or we are working in the tribal OES building, or a number of places where folks have reached out and said, hey, I'm still working. And let's just say, like, just because you're at home doesn't mean you're not working. I know a lot of people are balancing this, like, work from home. Work from home is not my favorite. um I will be super transparent. Like this setup, I had to set up a small office in my closet. So thankfully, I have a closet large enough to do that. But I just needed like a quiet space in my house because the kitchen table, even my bedroom wasn't getting it done. Like it just needed to be quieter. And I know many people are having to make those kinds of adjustments. Um, so let's stay calm. Let's but let's respond to this responsibly. Let's not share things about how this isn't a big deal or how we're so strong and great, we're going to get, we made it through everything before. Know that many of your ancestors and many of our generations who came before didn't make it through these things. And they prayed for you and I to be here. And it's our time. It's our time to be here. It's our time to do what we know best, and to be doing our part to reduce the spread of this. To be giving those thanks and those shout outs to those people who are showing up, those healthcare workers who are treating those who are sick, the janitorial services who are keeping our spaces clean and ready for us to enter, and just also taking the time to reflect. I've been seeing like a virtual powwow on Facebook, and that's incredible. Like, way to like really just fill Facebook with some really good medicine and beautiful songs and seeing beautiful regalia. That does a lot for me. It really does. I saw a bird singers from Quetzon yesterday, and man, like bird singers, they always move me. Um, so what a beautiful way that Indian country is reacting to this. And thank you to all of you for joining in and listening. And um, this makes me emotional because I think that it's really serious, and we have a lot to lose in Indian country. So we're looking at a generation of elders who are really like knowledge barriers for us. These are people who were born just after the turn of the century, the 19th century, and they remember a time where they were fluent speakers, and they remember a time where people were making baskets, and their grandparents remember a time of first contact potentially. And those are the people we need to be taking care of. We need to be looking out for them and doing our best to make sure that we're protecting that generation of people, because it would be devastating. I know as our elders have already passed in the last 10, 20, and 30 years, we have felt those, we have felt that. We have felt language loss. We have felt cultural losses. So it's our time. It's our time to step up. And I say that to you all on Facebook because I know, you know, many of the people on Facebook are not our 80 and 90-year-old and nearly 100-year-old elders. It's people that are younger. So please stay safe. Please know that I continue to pray every day for everyone. As Yurok people, we know that when we go into our world renewal ceremonies, you know, we're not just praying for Yurok people, we're praying for the whole world. And I think that's what we need to be doing now. It's not just about like thinking just about what's happening in your home or in your community, or, you know, if you know someone who's been sick, it doesn't matter. We need to be praying for everyone, and really hoping that we all make it through this, and that, you know, maybe I'll be doing a live in a few months and we'll be at a more positive place. And I think there are many things that feel really uncertain. We are uncertain about timelines. We are uncertain about when we're going to be in the clear. It's like what people are saying. I don't know. And CDC doesn't know, and science doesn't know yet, but we just need to keep doing what we know is right, and take the time to be with family, and take the time to you know, practice our languages at home, to make baskets if we have those materials at home, to teach our kids, maybe a time to speak about historically things that have happened. And it's true, Sonia, every day we are making life-saving decisions. And really, you know, my hat's off to you, healthcare administrators. I know many of you are on the call are on this Zoom right now, and I know you all are making decisions that are saving lives, that are saving patient lives, saving staff lives, and your ability to balance those needs is incredible. And so I want to thank each and every one of you, and tribal leaders who are making really difficult decisions. And everyone knows that anytime you close something or you issue a new order to protect people, that there's also stress and fear that comes with that. And I don't think anyone is taking that lightly. And so now is the time to be upholding and supporting our tribal leaders, and asking questions about how you can be supportive from where you're at. I'm going to sign off because it's getting really rambly, but happy Sunday afternoon. I think I'm going on a hike with my kids, maybe. I've heard different trails are really busy and not. Maybe we're just going to jump on the trampoline. But walk though. Thank you. Thank you all for joining.